Hey, Dr. Vicky here. So, I've had a lot of questions from a lot of different people as far as my patient that got her vision back after a stroke. And what I want to talk about today is the different aspects of that, because it's not just a magic thing that happens with patients. You have to have, number one, you have to have viable tissue in that optic area. So you have to have you have to have receptors in the eye that are working to send signals from there through the brainstem and then up to the brain. So that's one. Number two, you have to figure out which pathways you can access to make that pathway work. So it's not just magic. You have to figure out which one, if you're going to go through the brain, if you're going to go through the brainstem, if you're going to go through the cerebellum, which is your balance center. So you've got all these different areas that fire to other areas in the brain. So you have to figure out how you're going to access that. And it becomes very tricky because her pulse was 120, which is way high of where it should be. So that, given that fact, I knew that auditory and visual stim would not work for her because she already had such a high pulse that things were really cranking, and her brainstem is screaming. So we could not use that pathway. We had to use a different pathway. So I used a sensory system to access that area, and I used it, we did some other things too, in addition to that, besides the laser. So, and it slowly came back. So she got part of her visual pathway, and then the next time she came in, it had degraded a little bit. So then we worked on it again, and she got a little bit past that. So then we kept working on improving the actual spectrum of the vision field. So we got maybe to here the first day, we maybe got a little bit further the second day, and then the third day, and then we kept working until now she has complete vision all the way around, so 360 degrees. So it took a minute. It wasn't an overnight thing that was just magical. So if you know somebody that has a significant loss of some sort from an injury or from a stroke, then send them to Souder Chiropractic at 303-385-3432.